Oh, come on, focus. See, you ruined it already. God, this is why I know I could be professional. Thank you, Shalisa, for being so professional. My brothers are idiots. So basically, this is just to kind of gather normal people, who will basically give dentists an idea of what they think is important. I feel like in dentistry, we've gotten away from kind of listening to patients and gotten towards what if you go to a seminar, they tell you what's important, or they tell you what to sell, or what they like. If a dentist goes to a seminar and they learn about implants, that's all they're going to basically talk about, right? But that might not be important to you. You may not want to replace that tooth, right? So this is why I kind of gathered normal people, and I might do this for multiple stages here, but I gathered normal people to kind of ask questions, right? So we'll start off with, do you guys know that there are 12 specialty in dentistry? There's 12 of them, but you guys probably, yeah, exactly. That's a lot. But you guys probably only know, you guys know what a endodontist is?
I've heard the name.
I've heard you say it, yeah.
Okay.
Is that what you do?
Oh boy.
This is how I know my brothers don't care about anything.
I should have kept that to myself.
Okay, I'm a periodontist, not an endodontist. So
That's
an
close.
endodontist, no,
Yeah,
not even close at all. Not even. Oh God, Shalisa, if you want me to get rid of all of them, let me know. You and I can talk.
It's okay.
So an endodontist does root canals.
Oh yeah.
Has anybody heard of that? The
Yeah.
root canal specialist.
Yeah.
Okay. Did you know that the root canal specialist, I mean, that's all they do is root canals, right? But a general dentist, the one that you go to every 6 months, can also do root canals.
Yes.
Oh.
Okay.
So like a general dentist, they're like the jack of all trades. They can do all of them, right?
Right. So do you know what a periodontist is? That's what I do. Okay. I do implants. I do gum surgery. My main focus is on like gum disease, right? You guys know what periodontal disease is?
Yes.
Gingivitis?
Gingivitis, okay, worse than gingivitis, but yes, gingivitis and then worse, right? So if let's just say I do implants or I do any surgery, a general dentist can do the same thing.
Right.
Okay. Do you guys know what an oral surgeon is?
Isn't that a periodontist? Did you describe it?
Yeah, it's kind of like the same thing, right? A surgeon who does surgery on the mouth.
Okay, this is how little you guys care about my profession.
Didn't know I got a job, but okay.
Oral surgeon.
We only care when it's time for the procedure. Let's be honest.
Okay, so an oral surgeon, have you guys ever had wisdom teeth taken out?
Yes.
Oh, yeah.
That's most of the time. That's what they do. They do wisdom teeth and they'll do other stuff like biopsies and stuff. And again, a general dentist can do the same thing. Okay. Do you guys know what a pediatric dentist is?
Oh,
Yes.
yeah.
It's in the name. Oh, see, everybody knows that one, right?
Yeah.
Has anybody taken their kid to see a pediatric dentist?
No.
I don't have kids.
Okay. If you didn't have to answer that part, yes, you didn't have to say anything. See how that works? If it doesn't pertain to you, don't say anything. We should have said the rules before we did this. Okay.
Yeah, you should have.
Okay, so pediatric dentist basically sees kids. That's what they do.
Right.
From 6 months to about 18 years. After that, most of the time they don't see them,
Yeah.
But a general dentist can do the same thing. Okay. Orthodontist.
Richard.
Oh yeah.
Dang it.
Everybody knows what orthodontist is, right?
Yeah.
Yeah,
Braces.
orthodontists, they do braces, right? So out of the 5 that I've listed so far, you guys say what?
No, you froze for a little bit.
Oh, I'm sorry. So
But
out of
you're
the
back.
out of the 5 that I listed, you guys only knew one, which was the orthodontist.
I don't know about that.
Okay, how many did you guys know?
Yeah.
I would say everything but endodontist.
You didn't know the
Yeah.
endodontist, but
Yeah,
you knew,
yeah, so 4 out of
you knew the
5.
oral surgeon.
Yeah.
You knew what I did, periodontal. You confused the endodontist for periodonist. Okay. Okay. Well, what I'm getting is a lot of general dentists, they can do a lot of these things, right? But the part with specialists is, well, they're not trained to do this, right? Because after dental school, the general dentist stops going to specialty school. That's when we kick in. The specialty school will basically host, and the orthodontist will go to school for another like 3 years. The oral surgeon will go to school for 4 to 6 years extra. Okay, the periodontist would do 3 years. the endodontist would do 2 to 3 years. Okay. So they feel like, hey, if I'm a specialist in this, then I should be doing the work. But general dentists are like, well, this is my patient. I can take classes and courses and do the same kind of work that you do.
Fair.
Right. Sometimes, most of the time, the cost for a specialist to do the same work is less, but they come with more experience. They come with, that's all they do. I'm sorry, it's more. The
I was gonna say.
I'm sorry,
yeah.
I apologize. The specialist is more.
Cheating.
Right. The
Right.
specialist is more. General dentist is usually less. Insurance will pay
Right.
more to the specialist to do it. But remember, the specialist comes with more training, more hours and everything, right? That's all they do. Now, the question to you guys is, does it matter to you who does your work?
No.
No, it comes down to money. I mean, if the general dentist could do what the specialist could do, but at a cheaper cost, then I'm going to general dentist.
But remember, the specialist has more training. Does that matter to you guys?
No, because
it matters to me
Oh, you go
about
ahead.
what I'm gonna get. My end result is what matters to me.
The end result matters to you more. Okay.
Yes.
So does it matter to you that the person that's going to do the implant, will say, has more training and does this a lot more? Or can you say, hey, listen, if my general dentist could do the same thing, then why would I pay more?
It depends. For me personally, I had a really great relationship with my dentist for my darn near whole life. So if he said he couldn't do it and recommended someone else, I trusted that, and it was always the right decision. But being from a small town also, I feel like root canals and different things like that, my dentist may not have been a specialist in it, but he got a lot of practice because there were other people going to him for that same service.
Okay.
So I think that's something to take into consideration too. And I think you need to be worried about when something's recommended to you, like how is it recommended to you? And also, what is your health care? Like, are you going every 6 months like you're supposed to go? And if not, is that the reason why you need what you're being suggested?
Okay. So what about you guys? What matters more, the time and effort that, a specialist has, or cost, or recommendation by your general dentist? What matters to you guys when you decide to do a procedure with somebody?
To me, it's just basically the cost.
right.
I guess that's good or bad, but
Yeah, it's okay.
because I trust that they know what they're doing as being dentists. So if you're saying you could do a root canal, I'll believe you. But
Yeah,
I'm not gonna care if they're gonna like suggest other people, then I'll like consider. But like, I'm going to the cheaper option because it's all expensive to me.
Okay. So dental insurance, right? So you said it's all expensive to you. Dental insurance should sometimes cover cost, right? So if you have a procedure, there's two procedures that are very different. A root canal is to basically try to get you out of pain and keep the tooth, right? Or you can take the tooth out and do an implant, right? An implant most of the time is not covered, but a root canal most of the time is covered by insurance. One keeps the tooth, one you have to take it out and replace it, right? A lot of dentists are saying, hey, listen, I want to go ahead and get my patient something that they feel will last the longest, which is an implant, right? An endodontist might say, no, that's not true, right? If you do the root canal and you put a crown on there, which is cutting the tooth down and putting a cap on there, if you do that, that could last you a very long time too, right? So if your general dentist recommended do a root canal and a crown, would you go with that? Or if they say, hey, you know what, do that, take the tooth out and do an implant. Remember, the implant doesn't come with, it's kind of coming out of your own pocket. Which way would you guys go? Would you guys focus more on what your insurance covers, or would you focus on, hey, what my dentist recommends?
Right. I think whatever my insurance covers, because what you said was important. You said the specialist said it would last long too, not it would be better. So they're both going to last just as long. That's how I interpret it. So
Right.
why not go with the cheaper option?
Okay.
I agree. It also depends on where the tooth is. If it's in the back of my mouth, give me a root canal. Because what people don't understand about implants is you got to wait a certain amount of weeks for that place to heal up. And then that's a situation right there.
Okay. So
But
what
that's
if
assuming you understand the process though, right? If I didn't know anything.
And that's the
either
thing. I
way.
think some dentists don't explain the process
There it
when they
is.
first give you, the 2 suggestions.
Mhm.
So you want to do your own research as well. I feel like even, I don't care how long you've had a doctor, you should always still do some kind of research.
Right.
Do you guys
I mean-
think dentists are good at explaining stuff to patients?
I think they're
Some
good at.
are, some are not.
Oh, sorry. So I think they're good at telling people what they're doing. So for me personally, I don't like to be told what to do. I like to be given options, and then I would like to pick the best one for me, right? So if someone's telling me something to do something, to me, it's like a salesman. You're just trying to do what's in your best interest.
Well, that's what I was gonna say.
Options, then you allow me to pick the best option. And if you think that I should go a different way, then you should explain it, but allow me to understand myself.
I agree.
I think that's the thing. It's like I have a hard time, I guess, trusting that they're doing it for my best interest rather than the money. So like, I don't know if I'm actually hearing them explain it rather than like listening for how much it costs.
Mm.
So like every time they're saying like, oh, you should do this, and then I hear the dollar amount, I'm like, well, what's the other option?
Right.
And like not really trusting that they're actually doing it for my well-being, but rather just for a higher like dollar amount, I guess, and like focusing on that.
And how could they get you to understand that they're doing it for your best interest?
By giving us options and explaining which one is better, pros and cons, just allowing us to make the decision. Don't tell us what we need, just explain the difference. You can push us to one side or the other, but just allow us to give us the options.
Also, maybe like a storyboard, like tell me how I got to the situation that I'm in. Like I like when my doctor takes x-rays and they show me tooth by tooth what happened in the past or what is going on, what I need to look for. I think those are very beneficial for a patient. And again, if you're getting your regular checkups and you're taking heed to this information, you're taking care of yourself, then nothing should be a surprise if it's like, oh, I need a root canal. It's like you kind of start to feel that.
I mean, yeah, it's just taking back to the basics. Like, not everybody understands teeth, so break it down to the simplest. Explain to me like I'm a 5-year-old. Like, what is going on? Allow me to understand the process and how, like she said, how we got here and what are the best course of actions to resolve this issue. But explain it in a way that I understand.
Okay. When it comes to insurance, right? Would you like the dentist to kind of also tell you how much things are going to cost, or would you want somebody else separate from that dentist to tell you how much stuff are going to cost? Does that make sense? Like if I did a consultation with you and you asked me like, hey, that's going to cost, how much is it going to cost? And I'm like, oh, probably $500 for this one and maybe $1,000 for this one. Do you think that I'm basically leaning you towards one way or another? Or would you want the dentist to be like, well, I don't know how much it's going to cost, but I have somebody that does all that financing and stuff. They can talk to you. So separate myself from that. Or does it not matter to you at all who tells you how much it's going to cost?
Oh yeah, it matters.
So does it matter to you?
Can I answer?
Anybody can answer.
Yeah. So for me, it goes back to the trusting, like you said. Sometimes I feel like they're just being salesmen and they're trying to look out for their best interest. So to me, if they had like a third party, I wouldn't even go with one that they recommended. Maybe if there's like a third party that just says, okay, here are your options. This is, this one's a little pricier and this one's a little cheaper. And it's kind of like shopping around, just like when you're getting like car quotes, just like a third party to kind of let you know what are the different prices.
But you're paying for those quotes though, because you're getting a doctor, you're getting a dentist appointment, and you're going to see those dentists, so you're paying something.
Right.
But I do get what you're saying, because so I'll give you a personal situation. My mother is over 60. She's on Medicare. We've gone to the same dentist, and our dentist recently retired. And now I feel like a chain, but it's not a chain exactly yet. But basically one person has come and purchased and gave it a generic name. And it runs more of like, I guess, what most dentists are now. It's very like text and somewhat formal, but not as formal as we're used to. Because of her insurance, she now had to find another carrier. Well, her first visit, they're like, oh, you need 2 teeth caps. And I'm like, that sounds suspicious to me, because you've been going to the dentist every 6 months for God knows how long. And you've just been to the dentist and no one said that you need 2 teeth caps. So why now this new dentist office is saying that you need 2 teeth cap? And I said, I feel like you should get a second opinion. And that's when I feel like a second opinion is really worth it. Or if you're going to go to someone new, explain, I know my tooth history. I know this, when I last had my checkup on this date, this is what was going on with me, and nothing has changed. And maybe, tell me why you feel, I need more proof as to why you feel like I need to do these procedures.
So it almost sounds like you guys have a very limited trust of dentists.
I have a good trust, honestly,
Okay.
but I feel like I've had a good trust because my previous dentist, I've had him since I was a child.
Okay.
And for that, anything I've had go wrong, and I've had some things go wrong in my life, he's basically handled it like, if this was my child, this is what I would do, or this is where I would go. I can handle this, but you know what? I feel like we should use a specialist for this thing. And that's what's worked well for me. And because of that, I paid attention a lot to how he takes care of myself, my son, and even other patients. I feel like if you're in the office and you see how someone's dealing with another patient, take that into some consideration, because if you're in that position, they might be treating you the same way down the road.
So for me, I think of it as like, I'm a big football guy. So when someone like injures himself, they get like a knee sprain or an ACL sprain or whatever, before they get surgery, they get opinions from different doctors, right? Before they have to go through the worst case scenario. I don't understand why dentistry can't be the same way.
Okay.
I think it can,
Yeah.
but it also depends on too, if you go to a dentist where there's multiple physicians in that office, and then you can have someone else in that office maybe give you a second opinion or a third opinion. But then if you don't trust that office in general, then yes, you're trying to look for outside. So then what would you do? Ask a friend. Do you have a great dentist? That I feel like we don't share or talk about dentistry as much as we do general doctors or OBGYNs and anything else, because it's like, at the end of the day, yes, you want to keep your teeth healthy, but you can get a veneer, you can get an implant, you can get dentures. And yes, unfortunately, until you need them, those things are very expensive. Right. But I don't think people care as much about teeth health as they should.
Right. That was going to be my next point. How often, I don't know if you guys know the stats, but how often do the general populations go to the dentist? I mean, I know you're supposed to go twice a year, but do people really go?
I know a lot of people that do not go regularly,
right. So
or a year.
Right. So if you don't go regularly, so how do you build that trust to understand that
they don't, and that's why they're afraid. I know people that are personally afraid to go to the dentist to the point that they do not have teeth in their mouths.
Right.
That is bad.
Well, here's a question for you guys. Ready? Do you guys go to your primary care physician on a yearly basis, or only when you're sick?
A yearly basis.
Yeah, I go every year.
I'm in between.
Okay, so why do you guys go to that every year, but not to your dentist every 6 months?
Because they're taking like $200 out of my paycheck every month. They only take $6. My company.
For what?
For healthcare.
So your dental insurance. So you're talking about insurance. You're saying that you pay.
Insurance. Yeah,
you pay like $200 for your primary care.
I want to get my money.
You might as well go.
Right.
Okay, but your dental insurance is cheaper. So to you, that doesn't really matter as much.
Right. And I think it comes back to the point where it's like, I think most people just feel like if you brush your teeth and floss your teeth every day and you don't see any bleeding or your teeth aren't falling out, what is the point of going to the dentist?
Okay. Okay. I as a periodontist, my job is basically try to keep teeth. And I deal with a lot of gum disease. And gum disease, honestly, is not something that you can see.
Right.
It's underneath the gum, right? So most people come to me when it's pretty much too late or they need some kind of like intervention that costs a lot of money. Okay. Mm-hmm. And so that statement you just made, right, is what everybody believes. But to us dentists, it's kind of like I mean, you just got an X because we're like, wait a minute. Well, we have all these tools to see underneath the gum. So that's why you should come to us, because every 6 months we can take x-rays to make sure you don't have a cavity that you can't see. Let's make sure that you don't have gum disease that you can't see. You see what I'm saying? And so that's our argument. But you're saying to me, well, what does it really matter? I'm not paying that much for dental insurance if I do have dental insurance at all.
Right. And you're assuming that a lot of people are proactive, but a lot of people are not proactive.
Okay.
Like they go to the doctors when their stomach hurts. They don't, a lot of people, I don't feel like they go for like a regular checkup like I do, or I guess we do. They kind of go when it's needed, if they have a cold, but it's the same way with a dentist. Like if you don't feel a need to go to a dentist, if your teeth isn't hurting and you brush your teeth and you floss, you're not seeing any blood, then why go to the dentist? And like you said, like I explained before, not a lot of people have knowledge on, the stats you just said about gum disease. And so you don't know what you don't know. So it's kind of like out of mind, out of sight kind of thing.
Okay. See, dentists, we think that we're pretty important, right? We think that patients need us. And it sounds like you're saying we don't need you guys.
I mean, if it's not really life-threatening, right? If you lose your teeth.
Do you think dentistry is, do you think dental, dentists could save your life?
Oh,
Yes.
see, I mean, I don't know much about it, but maybe it could.
But I mean, in your mind, like dentists are, what do dentists really do for you?
It's for aesthetics.
There it is.
Okay. Richard, what do dentists do for you?
Yeah, I think it's just like, I mean, to clean and make sure your mouth is like clean and like doesn't have a disease. I don't know.
Okay, Alvin, what do dentists do for you?
I mean, I'm relatively the same, right? It's to fix and reverse, essentially, right? That's kind of the message that we've been getting all our lives, that right, an apple a day keeps the doctor away, and that kind of phrase, it makes us feel as though like, hey, we're in charge of the preventative stuff. When we get past the point of preventative, then we go to the doctors or the dentist to fix or reverse. You know what I mean?
So basically, the dentist's job is pretty much to fix problems that you develop
that we didn't prevent. At least from the messaging that we're getting.
So we're not preventative. We're more of let's just fix.
Reactive.
So reactive, yeah. So if your car is broken down, is when if your teeth are broken down, you go to the dentist. So we're mechanics.
Ooh,
I didn't want to say.
No.
Yeah,
Listen, I'm not
taking the connection.
I'm not taking anything personal. You guys are literally off of my Christmas list, but I'm not taking it personal. All these years, I've realized how little you guys think of me.
I'll say that for dentists to be important, I feel like it starts at a young age.
Right.
Okay.
Because I feel like that's why I feel like it's so important. I mean, you go twice a year. So it's like when I leave, I get my date for the next 6 months. It's not something I have to call back and schedule. I don't have to figure out what the date is. It's so automatic.
Okay. Okay. So have you guys ever heard that dentists doing little specials like come in for free whitening and free cleaning and stuff like that? Have you guys heard that?
No, and I probably would not go to a dentist that's offering that, because if a dentist has time to do that, then you really don't have any patience, in my opinion.
Well, there it is.
Okay, but I mean, this happens. A lot of dentists would be like, "Hey, you get free whitening trays and free cleaning with a dental exam," and you're saying that anybody that's giving you free stuff, you don't trust.
We get free toothbrushes.
Honestly,
first of all, those whitening trays, they are not cheap. So
they're not.
If you want to give it to me, I mean, cool, but I would be a little leery going to someone just for that reason.
Okay.
Wait, so can I ask a question?
Please, any question you guys want to ask.
So, in your opinion, you're the expert here. In your opinion,
I'm just a guy with an awesome headphone.
So, do you believe dentistry is just as important as like a physician?
I'm biased, but I do.
Yeah, right.
I do believe that, because don't forget. Yeah. So to me, I look at dentistry as like this. Ready? The mouth is the most important. I'll call it portal to the body. Okay. Right? If you want to, without eating, Without drinking, you can die fast, right? Right. And so we take in nutrients through the mouth. We take in liquid through the mouth, right? So to me, I'm like, you have basically told me that this is the starting point to our overall health. And that's why I truly believe dentistry is important. And because I've seen patients who didn't have teeth, who have lost weight, who have gotten sick, you see, because they can't eat normally, because they can't take care of themselves. You see, I've seen patients who have stopped laughing, smiling, change personalities completely because they don't have teeth. Right. So yes. And so in that sense, I'm very biased in the sense that I do think dentistry is as important as your primary care physician. Right.
So this is, oh, good.
No. And so that's why I say that. Now, do I believe that the general population believes that? I don't. I'm not foolish enough to think that. Do I believe that physicians believe that? I don't. I'll say this. I'll get a medical clearance and they don't even care what I read on there. They just say, oh, patient has high blood pressure. Yeah, you know what? Just, increase this and this and that. That's from a physician's point of view. They really don't even care. So I basically stop asking for permission. I just tell them this is what I'm doing. They really, most of the time, don't even know what I'm doing. So again, I don't think physicians even think dentists are important. But the funny thing is, dentists think we're very important. And so that's why we're having this discussion tonight, which is basically trying to get people to understand the level of importance and how can we teach the patients to understand how important we are, and how can we as dentists believe, learn where our level of importance is and what we can do to educate. And I think we've kind of had to disconnect. People think, if I come into a room and I'm like, you need a cap, you need a crown, right? In my mind, I'm like, I'm giving you so much knowledge, man. I'm awesome. I'm really saving you from other issues later on. You may be thinking, well, this guy's trying to sell me a used car.
Yeah.
And that's a disconnect. But I don't think that we're getting that in dental school. I don't think that we're getting that when we come out. I think the best dentists are the ones that can literally sit there and explain. But because of insurance, and I'm going to tell you what dentists say, because of insurance and stuff, we have to see more volume. So we don't have time to sit still and talk to people. You see, so patients don't understand. Dentists don't have time to explain. So we're in a weird vicious cycle right now. And I'm trying to figure out what we can do as dentists to kind of get everything back to what it used to be. Shalisa probably had a better experience with that one guy because that one guy took the time to explain everything. And that's why she really loved this person. You see, now it's more of how much can I get? How much, as dentists, how much can we do? Right. It's also about, hey, I'm sitting down, I'm listening to you. I'm trying to explain everything to you. But in all honesty, do I have time to do that? We see a lot of patients now, unless you're fee for service. And if you're fee for service, I don't take insurance at all. So I can sit there for 3 hours and explain to you, I'm charging you for those 3 hours. Does that make sense?
Right.
Yeah. So that's another thing too. So if you guys want somebody that sees insurance, you might be dealing with, have you guys ever gone to a dentist office and they're really busy? Right? They need to basically see a lot of volume in order to make them, break even or make money or whatever it may be. Because remember, dentistry is a business.
Yeah, that's what I think. Oh, go ahead.
No, please.
No, I was gonna say, I think that's what I think is the issue, at least in my eyes, that it doesn't ever seem genuine. So like, there's just certain professions that like you always second guess, whether it's like a car salesman, a real estate agent, a dentist. Like you always think like, well, first of all, you're always like
I love the fact that we're third.
No, like
not car salesmen.
No, because like you have different customers and like you don't genuinely like care. At least I have a dollar sign. So like it's about the sale rather than like, hey, I care for your well-being. So like you are a real estate agent. Hey, this is $100,000 house. You don't necessarily believe that. You think he's just trying to upsell you. So like, let's actually get to the point, because like we don't really like care for each other, but like you're trying to do your job and get the most for what you like your profession is. And I just don't believe you as like a customer, because it, like we don't have a relationship. And like this goes back to I see you 2 times a year at best. So like I don't know you, you don't know me. So like what you're doing is your job and you're trying to get the most money out of your job. So I just don't like trust it.
Yeah. You got family to feed too, right? Yeah.
Wow, I think that is probably the most honest I've ever gotten anybody to be about dentistry, because
earlier.
no, but I mean, you said it very eloquently right now, and you kind of said it to the point where you're like, listen, this is a transaction, but we don't believe that it's a transaction.
Yeah.
We don't believe it's a transaction. As dentists, we feel
I don't know if I agree with that.
Please, Shalisa.
I feel like I don't know if I feel like that. I feel like new age dentists, I feel like sometimes they come off like, yes, it's a transaction. I gave you a service. You're gonna, return the favor in paying me, or your insurance is going to pay me. Have a nice day. See you in 6 months or a year.
Okay.
And that's it.
So you're saying the new dentists act like that?
Yes.
But not the old dentists?
Not the old dentists.
Why do you think that's the case?
I think it's because of what you said. Like I don't know what numbers they're made to hit, or if it's the conferences that you guys go to and it's volume, and then from listening to your podcast, I mean, a dentist might just be that. They just might be the face, but they might have people on the back end that they have to, get numbers up for. So if you're someone who's in the middle, do you really have time to focus on the patient and being the patient, the person, and then the patient, the teeth as well? Because I feel like those are two separate things. You're there to deal with my teeth, but there's a person here too. So you have to pay attention to me as well as my mouth as well. You know what I mean? So if you get to know me, that's going to make me feel that's going to make me want to come back. But if you know my teeth better than you know me as an individual, then it's kind of like, well, I can go to anybody then.
You got to sell yourself.
So, okay. So you just said something right there. You said that dentist doesn't get to know you. Like, how can we do that in this, twice a year situation?
Honestly, I don't know if I just have a really good hygienist, but she really takes the hygienist at our office. She's been there maybe 2 years, and she has taken the time to get to know me and my son, to the point that the lady who she replaced told her about all of the patients. When we got there, she knew who we were. She asked us questions. We conversed, where are you from? And I don't know what her level of how many patients she has for the full year that should be probably taken into consideration. Mm-hmm. But when we go, she remembers us. It seems genuine. Owen looks for it to the point where this woman was just on vacation, and he was like, where is, and I feel bad because I don't know her name.
That's okay. So you don't need to say anything.
He was like, where is she? Like, and they were like, oh, she's on vacation. She wanted to let you know that she'll be back for your next visit. And it's stuff like that lets you know, okay, I'm in good hands, I feel like.
Yeah.
Okay, here's a battle that a lot of dentists have. Ready? We have either somebody that's really genuine, comes across really genuine, is really a people person, versus somebody that... You say it again?
They suck at their job.
Or somebody that is just not good at what they do, right? And so somebody could be really good at being a people person, can talk you into doing all this stuff, but then when a dentist looks at their work, they're like, oh my god, this is garbage. But patients don't seem to know the difference, right? And they don't seem to care. So the question is, like, what's important to you guys? Is it the quality of work with a crappy attitude, meaning that the person just sees you as a mouth, but listen, their work is immaculate, or the person that sees you as a person, but their work is not good? What matters to you more? I know it's a very...
But how would we know if their work isn't immaculate? But you would only know that. I wouldn't know that unless
other dentists
did something to me, right? And then I left, and then 2 days later or a week later, I'm like, hey, you worked on this tooth here and it's still hurting and I don't understand what's going on. And if I call you and say that, I don't want to hear, well, what did you do? I would want to hear, hey, I have an appointment at 1:00. Is this going to work for you? Let's get you in here as soon as possible. So I think we want the good work, obviously.
Of course.
I'm not saying you need to know my mother's name and my son's saying, I don't want to come into your chair with a stinky attitude, or you not saying anything at all.
So personality matters most out of everything.
To a degree, yeah.
For everything, yeah.
And I'm not hard to
For everything.
please at all. I mean, come in
Yeah.
and do your job, but I don't want to be. I've been in doctor's offices where you almost feel like, you know, they don't even want to touch you. So you don't want that experience.
Mm-hmm.
Okay, so if I told you guys that the average dentist makes about 170, $170,000, and the average specialist makes about $323,000. Okay, would you think that they deserve that income?
I think it is a specialized role where like not everybody can do it or has like the patience to do it. And I mean, it just takes so much knowledge, I think. So like for that reason, to have it, because like the schooling itself, I would believe that it takes a lot just from that alone. So like it's not just something that you can just pick up one day.
Okay. Does anybody disagree with that?
Well, you said a general dentist makes 170 and
170,
300 to me.
323. Yeah, on average.
To me, I feel like it should be the opposite way. So because if you look at it, I understand the specialist is more obviously specialized in what they do.
Yeah.
But the general dentist is almost like the jack of all trades. They can literally do everything, right? So like I'm kind of putting it back on me. So in my job, I want to be as valuable as possible. So I want to learn different crafts, right?
Okay.
So that if they need me somewhere else, they can call me.
Okay.
Right? So a general dentist, they can put in your braces, they can give you a root canal, they can do whatever you do, perio, whatever. And they can do but they can hit all the points, right? And that to me is more valuable than a specialist would make more money, right?
So do you think that the general dentist
I think we think that in every industry, but that's not the case.
Right.
Yeah.
So for example, okay, so dentistry seems to be very in the health field seems to be the only one that does this. You've never gone to your primary care physician and then schedule you to do your open heart surgery.
Right.
Or your knee surgery, right? Because the general practitioner does kind of generalizes, and then it's like a quarterback or point guard disperses to who you need. But in dentistry, it's literally kind of the opposite. The general dentist can literally do any and everything they want to do. Do you find that to be concerning?
Right. So I found out, I think it's the opposite. Like I use a sports analogy. Like if Anthony Davis can play point guard, if LeBron James could play all 5 positions, then he's more valuable than a Shaq who could only play a center, right?
Okay.
So I would think, the general dentist, in my opinion, because they can do multiple things, will be more valuable. And even if they can't do it, they have the knowledge to recommend you to somebody more, I guess, suited for the position. But they just have that ability to kind of touch so many different, practices or disciplines.
Does anybody think that this is a problem that one person wants to do multiple things?
So I think for me, I think I have to understand the depth of which the general dentist actually goes into, right? Are they doing the exact same thing as a specialist? Because initially before this conversation, I was thinking that the specialists had more liability, right? Which is why they probably got paid more. They're doing deeper work. They're doing more, work that maybe touches nerves and everything, where a general dentist could probably do the surface level things. But if I'm not understanding that correctly, and a general dentist can actually do the exact same work as specialists, then I am a little confused as to why
they can do exactly the same thing. Yeah, they can do the exact same thing. The only difference is, you keep using this quote, Justin, which is jack of all trades, but you don't ever finish it, which is master of none.
Right. Okay.
And the specialist does the mastering part.
That's not all of the quote now.
No, go ahead. Break it down.
Break
it down. No, but break it down, right?
I think it's something like, but a master of many is better than a master of one.
A master of many is better than a master of one. Okay. Well, so break that down. Do you truly believe that, right? If
I do. do, because look at, like, okay, if you can
But
farm, and if you can also work on a car
you said
a
master
little bit. Well, I don't believe it is a master, but it's basically, if you can do some of more things than be a master of one thing, that's still better, because only being able to clean teeth, but you can't do surgery on the teeth, is you being able to do surgery and clean the teeth and extract the tooth is always going to be better, because you're that shows that you have skill, that shows that you're able to learn, that shows that you're able to retain, in my opinion. And if you're willing to do those things, then hopefully you're going to you can go to the full extent, or you can work through it.
Okay. So if somebody goes to school and only does this, right? It's kind of like this. If for example, how many dual athletes do you guys know?
Maybe 3, like
Bo Jackson,
Jordan,
Sanders,
right?
Michael Jordan,
yeah,
right. So there are athletes that could do multiple things, right? But how many of them actually can master and do a sport to the level of a professional? Does that make sense? Even Jordan couldn't really do it in baseball, right? And so the argument for a specialist is, I have literally specialized in this field. I know how to do it the best out of anybody.
Yeah,
as a general dentist, right? They're basically saying I'm dabbling in certain things, right? And not to say that some general dentists cannot get to that level of mastery. What I'm saying is, just like with anything, right? It's like, if you just dabble in this, and this, but somebody does it every single day, who do you think is going to be better in the end?
So I think
that's the argument that the specialists make, by the way. So I got to do the counterpoint so you guys kind of get everything.
But I feel like that analogy is kind of moving the goalposts just a little bit, because they're two different sports, right? So we're talking within the confines of one discipline, right? So, your analogy is almost like a dentist transitioning to being a doctor. But I'm saying, like, if you're LeBron James and you can play point guard, shooting guard, power forward, and center, you're still within that realm of that discipline. Like a general dentist is, it's more valuable to be a Shaq who can only play center.
Right. So let me go ahead and kind of break it down. This is how I always do this. Ready? So within the mouth, right? An endodontist and an oral surgeon are very different. An endodontist wants to keep that tooth in there, so they work within the tooth. An oral surgeon takes that tooth out. You see, one keeps the tooth, one takes the tooth out. One has a very special trait that basically just focuses on keeping that inside canal and everything clean and fixing it from within. The oral surgeon literally takes the tooth out, so they don't even worry about that tooth at all. You see how, like, it's like two special specialties. There's two different techniques. There's two different things to learn when it comes to that. Does that make sense? Yes, it is a tooth, but the mindset is very different. One is to keep, one is to take. That's why I use different analogies. That's what I was trying to get with that.
Yeah, but it almost sounds like within your argument, you're kind of strengthening what we're saying, that a general dentist is very valuable, because there's two ways of thinking, and yet they can touch all 5 of them.
Okay.
Right.
Okay.
So this almost sounds like you're kind of strengthening.
No, I'm just giving you guys information. I'm not strengthening or denying. No, I'm just basically giving you the reason why for the different, right? Because an orthodontist is basically there to straighten teeth. Right. While a periodontist doesn't care about how straight your teeth are, I'm just basically trying to keep the teeth from getting decay, keeping the teeth, from losing bone. Right. Orthodontists work within the bone. I basically say, I need to keep these bone here. I don't care how nice your teeth are. I just want to make sure that the teeth stays where it is and so forth. You don't get the disease. Right. And sometimes I actually do surgery that actually will eliminate some of the prettiness of teeth, right? If your bone level is down here and your gums are up here, I might need to bring your gums down, and that makes your teeth look a little longer. That's not pretty. I know that, but guess what? I'm trying to keep your teeth. So again, I'm not strengthening or denying or anything, but this is what I'm telling you. Most general dentists and most specialists, their mindset is, hey, I'm a specialist. All I do is this. I'm better than the general dentist who basically tries to do everything.
So I
But
think
this is why education is important, because see how you just explained that. Now, not every individual, like it's 5 of us here, we might not all look at our smiles and our teeth the same way.
Right.
I might say teeth whiteness is important to me. Justin might say, I don't care how white my teeth are. I care about how straight they are.
Okay.
But we're not going to know that unless our dentist explains those interests. Like, what do you want? What do you want your outcome to be? I don't think dentists ask that question enough.
And I think that kind of goes back to what we said earlier, where like it starts when you're a child. Like, because when you're in school, you have health class, you have gym class, you have anatomy, physiology, you have even sex ed, you have all these things, chemistry, biology, that explain bodies, you know, that explains why it's important to go to the doctor, right? But there's no classes that really talk about the importance of going to the dentist and explaining the different things that you need to go to the dentist. So to your question, I think maybe the solution is to have, you know, classes that kind of talk about how important teeth are at a very young age. So, you know, we at least have that foundation when we're going to the dentist, and we can start there. And then the dentist can kind of add on to the education.
Okay. Yeah, okay. Let me ask you guys one more thing, and then we'll kind of wrap it up. I had a whole list of stuff, but I'm just going to wrap. I've kept you guys way too long, and I appreciate your time. Here's the thing. Would you go to a dentist office that has a lot of technology, like, you know, lasers and you know, 3-dimensional scanners and so forth? Or does that not really matter to you guys? Do you guys think technology, you know, fancy technology and stuff like that matters to you guys? Or is it just, look, I'm just here to get my teeth clean. I'm here to do my work. I don't care about your laser or your big screen TVs and all that stuff.
It can matter, but when it comes to that kind of stuff, it really pertains and depends on what insurance covers. You have some insurance that don't even, but it does, because those lasers they're going to cost me money. They're costing me money, but in the end, it's going to cost me money. Right. So if my insurance doesn't pay for it and you want to give me some special treatment every year, right, and it's $400, I might skip that.
Okay. So technology,
depending on what it was, you know, I might do it, I might not do it.
Okay, well, so here's the thing, Reddy. Let me break it down even more. So we have some technology that allows you to get a crown in the office versus having to go into a temporary and then wait like 2 weeks. You can actually get that crown done within 2 hours. Would that change your mind on, would that change your mind?
Yeah, I would use that.
Okay, so would insurance matter at that time?
Probably not, because I feel like, you know, going into it, how much your insurance carrier is going to pay.
Well, insurance doesn't pay for this. I'm giving you this option to reduce your time of getting your final product to 2 hours versus 2 weeks. But insurance does not pay for it.
Ooh, that's tough.
That might depend.
Well, then the question is how valuable is your time?
On the cost for me. It's not that I wouldn't mind paying out of pocket. It's just how much out of pocket am I willing to pay that?
I mean, like
a crown is what, $300?
Nope, a crown is almost $1,000.
Oh, I've never paid that.
Right, because your insurance covered.
Yeah.
Yeah, your insurance covered it. So let's just say that they say, well, you know what, this insurance, you know, I can get you the crown in 2 hours, but your insurance is not going to cover it, so I'm going to go ahead and charge you for the $1,000 for it. But it saved you 2 weeks.
Yeah, I mean,
that crown is in the back of my mouth. I'll wait that 2 weeks.
Yeah, I think it all comes down to, honestly, like the payment and how much your insurance actually does cover.
Because so insurance still matters a lot versus technology.
Yeah, if it's cheaper, I'm gonna have to get it done, I guess, eventually. But like, if it's not life threatening, then I'll wait if it's cheaper.
Okay. Justin, you're kind of on the fence, it seems.
Yeah, this one I might.
You said if it's not life threatening, but the thing is, if you keep putting it off, it will become.
Right.
Even that goes back to not trusting. It's like, I feel like it's a lose-lose for the dentist, because I just won't trust you regardless. I don't trust you.
I feel like he has trust issues, and this is not a therapy session. So
work on him. Walk.
Oh no! Listen, I've been trying this for like almost 30 years. I'm giving up. They don't even know what I do. Justin, you're on the fence. Why? So does technology matter when it saves you time,
Yeah, that's where it comes into play. That's where it kind of changes the dynamic when you talk about time. I think today, especially in today's day and age, we pay that extra fee for convenience, right? We want to have our time. So, we spend an extra $8 on Grubhub when we can go down the street and get the food ourselves because it saves us time. We can do other things. So I think when you factor in time, I think people are a little more willing to pay a little bit more because you said 2 hours versus 2 weeks. I mean, that's significant. And time is a
It
great
depends on
equalizer,
the
honestly.
person. Value is determined by the person who's taking it, not the person who's giving it. So he's right. I wouldn't pay for Grubhub. I don't even like to pay an ATM fee to get my own money out. So
that is true.
But there are a lot of people who would, right?
But there are. I know it. You're absolutely right.
Yeah.
A lot of people that are like, "Oh, I don't care. It cost me $5. That's fine."
Right.
So how does a dentist determine what matters to the patient? Because I mean, we try to generalize and say that everybody cares about the price of something, but Justin just proved that. Look, sometimes time is more valuable than the price.
Patient surveys. I don't know why doctors don't use them in a way that benefits the patient as well as the doctors and or the office themselves, because you'll be able to know if you do a survey to say, okay, what does my patient value? Do they value cost or do they value time? If you have a patient that's like, listen, I value my time, then offering services like that to them, that's a shoe-in. So, but to someone who's like money, then you have something to offer them. And it's like, listen, but also understand we have this other option if you're interested in it. And that's where I think Justin said before, it's give me the options. Don't just tell me this is all I have. This is option A. This is option B. Option A costs this. Option B costs this.
Okay. Well, we'll end it here, but I definitely appreciate you guys, and I hope my brothers actually learned what I do. I doubt it. But thank you guys for taking your time. I really do appreciate just the time that you guys took. I'm gonna send this to a few dentists that I know, and if you guys don't mind, I want to try to get other people on here so we can have this discussion, because I do believe that us dentists are naive to thinking to basically think, one, people know what we do, to think that what we say matters, right? To think that if we recommend something, we're insulted if the patient doesn't go with it. But there's more to that, right? There's, hey, did you explain it well? And then we have the plain simple, we're number 3 on the list of people today we don't trust at all, according to Richard. We're, I think, under sales.
I don't think you're number 3. I think you're bottom of the list.
No one seems to trust dentists, and I don't think that's something that I really think we need to work on, because in the end, it's like, okay, how can you trust a physician but you don't trust a dentist? And we think we hold ourselves to the same level as a physician.
Right.
So this is actually very eye-opening. Yeah, I don't know, guys. I don't know what to do, but this is something that was very interesting. I really appreciate your honesty. Does anybody have any questions before we wrap it up?
It just comes down to communication and knowledge.
Yes.
That's how it boils down to.
Would you guys appreciate if a dentist office sent you guys, like, let's just say you guys wanted to do a procedure, if they said you need a crown, if the dentist sent you a video of them explaining that crown, would that be as good as them explaining it in front of you?
No, it's not personable at all.
Okay.
It'd be better though than nothing.
It's better.
Yeah, I agree.
It's better than nothing. It's not personable at all. Okay. Okay. All right. But we use YouTube a lot.
Doctor can't explain it. I mean, you have there's dentists, general. I don't want to get the terminology wrong,
assistants,
but there's
dental
other
assistants.
people in the office that usually can explain. At least that's been my experience.
Okay.
In some cases.
But who do you guys trust more? The dentist, the assistant, the front office people? Who would you trust more when it comes to it?
It's technically the dentist.
The dentist, yeah.
You would trust
the person who's going to do the work, yeah.
Okay, but you guys also said that dentists are out for the money.
Yeah.
I don't think all dentists are out for their money, but there definitely are some.
Okay. And how do you tell when a dentist is just out for the money?
It comes down to them. Honestly,
you,
you
can tell.
it comes down to how much they explain what your options are and what the procedure is, and if they could recommend something versus if they tell you, okay, I recommend you do this, or I tell you you should do this. It just comes down to how much knowledge they give you, and with them feeling like, I'll give you the knowledge and I want you to trust your best judgment to pick an option. That's what I think for me determines whether, I would trust them or not.
I think really quickly that's what I had the experience here when I had a new dentist. All she was saying was like, you need to do this, you need to do this, you need this. And I've never heard that before. Mm-hmm. And it was like, well, this is how much you need to pay. This is how much it's going to be. So like, she didn't really like tell me why. She just told me I needed to do it. And I'm just like, where this is coming from.
Okay.
That's another, I think, sign too. When you get a list of stuff.
Yeah.
It shouldn't even be a list. Like they're better off starting with one thing. But I feel like, to me, those are the dentist sharks. They're like, oh, I got someone that I think that I can, and they don't want to let you go. And it's like, but then you start to have problems.
Yeah. But what if you do have a lot of issues? Should they not give you a list of all the issues?
They should tell you, but then before they tell you, maybe there needs to be a step back here. And let's say, again, it's like, when was your last checkup? Why are you not going to the dentist? Because anyone who has a laundry list of things that they need done has not gone to the dentist in a year or 2 years or 3 years or 4 years. Let's be honest. And if they have gone, then there's some other health issues that are probably going on, which is causing issues with their teeth possibly as well. So I've had dentists, I think I was grinding my teeth and they were like, oh, you should probably see your physician. And I had to, and it wasn't my teeth. It was actually something else that I had like a sinus infection or something, but it was causing my jaw to hurt. So you gotta.
So that was the thing with me. It was like the grinding the teeth, the sensitive, I had like sensitive thing. And although I guess I knew with the sensitivity, it was never an issue for my other dentist. And I go regularly. I go every 6 months. Sometimes I go even more when I'm in Houston, Walter. So like, it
just notice how he just uses me. He doesn't care about anything
I'm
else.
getting me something.
It just felt like a list that it just felt like I was being not attacked, but like just being like, hey, so it's just like overwhelming.
You were getting taken advantage of.
Yeah, so that's why I felt like, and also the reviews back that up. Like on Yelp when I was like looking on that. So like it wasn't just a me thing. So looking at the reviews, it was like they only want the money, and it was just like confirming that. So
okay, well now you got me asking one more question. What matters? How do you guys pick dentists? Is it seeing them on Instagram? Is it asking your friends? Is it just going randomly based on what your insurance says?
I go on Yelp.
Reviews.
The review sites.
So you basically search dentist around me or near me, and then you go through the list, and then whoever has a better review.
You sort.
You sort it out. God forbid Justin has to do extra work. You sort it out.
Reviews are important, though.
Yeah. Okay. It's just like, I have to look at if they're on the insurance and if they have good reviews.
Okay, but so that combination.
Yeah, sometimes, the reviews are personal, but like, it was overwhelming. This one I didn't vet good enough, which I no longer go. And I'll find the dentist's name so we can call them out.
Nope.
Ooh, okay. Nope. He's tired. Nope. He's tired.
That's where we wrap it up.
No, because he's out of control.
But okay, so you say no, but honestly, he should be allowed to call the dentist out, because then if you call the dentist out, then they won't continue to do that kind of behavior. I would hope.
Well,
because I feel like
yes,
if he has information to back up what he stated, which I believe he does, then I feel like
don't be surprised if he doesn't. Don't be surprised if he does not.
Feel like, oh well, I didn't do that. If he or she did do all of those things, and then there's all these Yelp reviews to also back that up, because that's another thing. We'll go to some place knowing that we've been treated unfairly, or didn't get the proper, didn't get the proper care that we were supposed to. And then you don't write about it. So now you're even letting someone else go to that same doctor and they're not getting proper care either.
Well, what if the reviews are just kind of basically people venting, right? Like a Karen, Just goes on there, just say,
I
like,
would. I disagree with that.
do you read more reviews, or do you just like look
Yeah.
at one or two reviews, or do you just go straight to the bad ones? Does that make sense?
Let's be honest. We're talking about dentists here. There's not like there's hundreds of reviews. You're
Oh.
lucky if you find 5.
Oh,
We're all
she's attacking us.
There's not a lot. So
Okay.
I'm gonna read all of them.
Oh,
If it's a doctor, if it's a dentist, I'm gonna read them all.
okay.
I'm gonna read the bad ones. I'm gonna
Good ones.
read the in the middle ones, and I'm gonna read,
Okay.
all the good ones, and not just on Yelp, but on Google and maybe on Facebook, because you're taking my time, you're taking my money, and I only have one life, regardless of what part of the body you're looking at.
Right.
So
Okay. Well, wow. This was insightful. Thank you, guys. I wish I could literally have just a podcast with you guys. Like I think that'd be more insightful than all the other ones I've done in the past. You know what I mean? Because this was within an hour. You have given, I think, so much wisdom, and a lot of hatred for dentists.
I don't hate dentists. I love dentists.
Well, Richard doesn't trust us.
You know that. I listen to all your podcasts.
Justin thinks that we're just crooks. And Alvin, you're probably the most indifferent of everybody tonight. You know what I mean? But you might
enjoying the show. Really.
Oh, okay, there you go. So nothing to contribute. Just wanted to listen to us being bashed. But no, it's actually really good though. Right. No, it's actually really good. It's amazing when you when you put a mirror in front of dentists, it basically, they think a lot, some, level of themselves, right? I've gone to school for this long. I'm a doctor, But when you take the mirror out and you let somebody else actually evaluate, you actually see how important you really are.
Yeah.
And I'm not sure if we have the ability to remove that and put somebody in front of us that can honestly give us the truth. And so that's why I wanted to do this. I wanted normal people, to basically evaluate. And my brothers are not nice to anybody, or especially not me. So I figured they would be honest. And sure enough, they were very honest. So for anybody thinking that I was biased, I could have picked better people. I could have picked people that literally would have been on my side. Yeah, my brothers don't care. So yeah, this is not a biased situation. This was who's going to give you the most honest truth. And I definitely appreciate you guys for that, man. You guys go enjoy yourselves. Thank you.
All right.
This was fun. Thanks.
All right. I'll send you guys everything. All right. Bye.
Okay.
Bye.